Walton, thanks for coming in today. You came to us about 3 months ago, is that correct?
Correct.
And you were referred in by one of your employees who was familiar with our office. And you came in for polymyalgia rheumatica, is that correct?
Right.
Okay. And during the case history, we also noticed that you're on medication for type 2 diabetes, metformin, is that correct?
Right.
Okay. How did you feel about coming in the beginning, and as a medical doctor, was there any trepidation about doing a program that was more holistic or natural?
No, I'm interested in holistic.
Yeah, no, I think that's been great about you, that you've, one, you wanted to try the program, and two, now you're showing enough interest that you're trying to learn about it and, see what you can do on your own. So, when you first came in, the first thing we did was take x-rays of your neck. And we had you fill out a metabolic assessment form so we can kind of get an idea of what parts of your body were not working correctly, so that we can try and get you back to a level of health that would allow you to feel better. How are you feeling at this time?
Much better.
Much better. Could you be more specific?
I've lost a lot of weight. I'm diabetic. Medication needs are cut in half. My blood sugar is much better. My pain is much diminished.
Great. That's great. So when you first came in, we started doing adjustments right away. Was this the first chiropractic experience you ever had?
No.
So you've had experiences before.
Yes.
And you've seen both myself and Dr. Sinagra. We also started right away with a food journal so we can see what you're eating and try and get you on what we call an anti-inflammatory diet. How did you find the diet?
Tough.
You found it tough.
Very tough.
So was it that there were difficult food choices?
No, it was the absence of the bread and all the stuff that I used to
The stuff that causes type 2 diabetes.
That's correct.
But as you started to eat more properly, based on your blood work, do you still find it difficult, or do you...
Yeah, it still requires discipline. The bread and mostly bread and wheat.
Yeah, those are easy, filling foods that a lot of people eat. But yet, are you finding yourself hungry, or do you feel, fairly well satiated?
No, there's a difference between hunger and satiation. I don't feel so hungry, but my body wants that sugar input, that bread and wheat. Yeah,
I think, every patient we have, some find it more difficult than others to make the changes. But, particularly with our patients who have blood sugar issues that may be driving a lot of their problems, it's just something that, I'm glad you at least understand or understood that that's something that we have to deal with, and you've done it, and then you're successful because of your diligence.
Yeah, I cheat from now and then, tiny bit, but on the whole, I'm compliant.
You are. And how about the supplements? How do you find those?
Supplements, not bad. The pills are large, so it takes me time to get them down. But other than that, it's not a problem.
Doc, how long did it take before you started to feel and see improvement?
I'd say 2 or 3 weeks.
That's great. Now, how long have you suffered with these problems?
Polymyalgia, about 6-7 months. Diabetes, 15 years.
Okay. And in just a short couple of weeks, you could see quickly how between, the adjustments, the supplements, the diet changes, how it can affect your health.
10-15 pounds in about a month.
Right. And you just came back from an out west ski trip, huh? And how'd the body fare during that? It fared good.
Yeah, it held up.
Okay. So I guess the big thing we're trying to share with our patients, or maybe our audience more than our patients, is that there are people out there with problems, whether it's one of the rheumatoids or some other autoimmune condition, or type 2 diabetes type problem, or bowel problems. Is this a program you would recommend to?
Yes, I've recommended my wife. I'm working on a friend of mine who has significant autoimmune problems.
Okay.
This is a very important issue to treat the whole body and not just hit target symptoms.
No question, no question. So, have you implemented this in your practice at all?
Yes, actually, I've gotten patients to be urge them to get much more holistic and comprehensive in addressing things like diabetes and rheumatism and other autoimmune issues.
Great. Now, as far as coming to our office, what was your experience like here? Between staff, the doctors, scheduling?
It was fine. Very, very easy.
Okay, that's great. Doc, I really appreciate your time today. I'm glad you're feeling better, and I hope to have a continued long relationship with you.